Good afternoon, everybody. I'm Donald Clark. I am one of the acupuncturists here at CNY Fertility, CNY Healing Arts. I Today's a little different. I know we were talking about continuing with Chinese medicine, and we've been doing a great job with that. And all the feedback I get, everyone's been doing really well with meditating and breathing and eating. But I'm trying to bring special guests on to make everyone's life a little easier, make your life a little easier on the day of transfer, and what kind of a behind the scenes look into CMI fertility, so you kind of know a little bit more about how things work here. So today we have Lily. She is our transfer nurse, and she's going to talk to you a little bit about what to expect on the day of transfer, some of the things you can expect to see on that day. We've talked about acupuncture and Chinese medicine on the day of transfer a few times, so I'm sure you're all versed in it. Most patients will get acupuncture right before the embryo transfer and right after the embryo transfer. And what it does for before the transfer is that it slows you down. It slows your body down. It slows your brain rhythms down. And what happens is you will find that your body thinks it's supposed to be sleeping. So your body gets really relaxed and you get really relaxed, and everything kind of goes much more smoother than that. And then afterwards, acupuncture helps prevent cramps, uterine cramps. We don't want uterine cramps for that. So most people, I'd say 90, close to 90% of everybody gets acupuncture because it's that beneficial, and it has that positive statistics and rewards to it. So that's why we do it. But today we're going to talk a little bit, or I'm going to let Lily talk to you guys about what you can expect on the day of transfer. Everything from coming in and what she's going to go through, basically what she does throughout the embryo transfer, right from the moment she sees you right to the end. And it's brief. It's not long. It's not complicated. It's quite brief, and but very, very important knowledge to have. And so we're going to do that. If you have questions, shoot us some questions, and we'll try to get to them. And I really hope this all helps you. I'm just kind of looking at some questions now, and Lily has fans. She has fans. So without further ado, Lily.
Thank you. Okay, so the day of transfer, usually you check in at the CNY Healing Arts area. Like DJ said, if you're going to do acupuncture, it's always a great benefit. Helps to keep you relaxed and everything. Elizabeth, transfer, not retrievals. So, and thank you, Alex. So yeah, you're going to have your acupuncture. If you choose not to, that's also fine. Valium's always an option for those that want it. However, it's not necessarily, not everybody wants it. So it's completely up to you. We would give it to you once you get into your room, and we'd give you time for it to kick in and work. We ask that you have a full bladder because we can't really see anything on the ultrasound machines if you don't, because it works off sound waves. It also helps to, put your uterus in a place where we can get into it nice and easily to eliminate any kind of complications. The procedure itself is super quick. We insert the catheter. You get to watch everything on the ultrasound machine, so it's really great. Yeah, sometimes the water will make you sick. So if you come in slowly, or not come in slowly, but if you drink slowly throughout the process of, coming in and, before your acupuncture, right after it, as opposed to trying to slam a bunch of water, usually that'll be a little bit more helpful. So after, we put the catheter and everything, you get to watch everything on the screen. Embryology will come in and bring your embryos in, and then you get to see them be put into your uterus. It's really great. In the procedure, it's not painful or anything. Yes, we do let spouses come in. You can also videotape it. We really don't mind. or there's pictures, whatever you want to do. What else was I going to say? After the transfer, you just lay there for a few minutes if you want to. They're not going to fall out, so you can get right up if you choose to use the bathroom, because that's usually the hot spot right after the transfer. And then we would send you upstairs, or sometimes you stay in the room and you would have your post acupuncture. Is there any other questions? I feel like I'm missing something. We also do your blood work when you get here if you didn't have it like the day before. So we check your estrogen and progesterone levels. We give you the results later on in the day so we can change anything if needed. The embryo glue is usually, unless somebody doesn't want it, it's pretty standard at this point. So when they thaw your embryo, they take care of all of that. It's not really a glue. It's more of just a solution that it's in. We just call it embryo glue. So it won't change anything at all. Yes, Katie, it is super quick and easy. And I'm so glad you have 2 babies. Let's see. Sorry, guys, I'm trying to read all these. The acupuncture sessions are probably like 15, 20, 30 minutes or so before, and then the same for after. Not time-wise, but like that's how long the acupuncture is.
Time kind of stops here.
Yeah, DJ's right. Time does stop here. It doesn't really matter what's going on if your bladder's not full enough, or if you have to fill more. Time doesn't really matter. We wait. It's totally fine. It's your day. It's your special day. I don't know anything about billing, so the starting costs and everything else, you're going to have to reach out to like our billing department or someone like that. I can't really talk about the financial stuff. I don't know enough about that. Sorry, guys. So the understanding of embryo glue is it's a solution that the embryos will go into right before transfer, which just helps them to stick. So that's pretty much what I know about it. I don't know like the whole chemical makeup of it or anything like that, but that's what that is. I can let DJ answer the question about if there's anything you shouldn't do before getting acupuncture, because I'm not certain. We know that the embryos have left the catheter because we always send it back to the embryology team, and they check the catheters right after transfer. So we do the transfer, and then they bring it in right back into the embryology room, and they double check the catheter to make sure it's clear. And if it's clear, that means it's inside of you. Staying in hotels the night before, I mean, I guess it depends on where you're coming from. Sometimes flights will get delayed. Again, depending on the time, usually time doesn't matter here. But if you have, a flight that's delayed and won't get here until 5, 6 o'clock, then sometimes we have to like push it to the next morning if it's a fresh transfer or even a frozen. But usually we try to work around things and to make it work. The interlipids, so it helps against the killer cells in the body to help your embryo stick and stay put. Heather, that might be that. I'm really not certain. That'd be an embryology question. Sorry, guys, let me read. So, Amber, for the positive pregnancy test, it really depends, because we try to encourage you to wait until the blood work, because you could have, a false negative, and we don't want you to be discouraged. It also causes a lot of stress and anxiety on somebody if they're taking too many home tests. And depending on if you did a trigger shot or if you're doing HCG boosters, things of that nature, then you're going to have a positive test. And then, you're kind of just throwing your money down the drain. So we do tend to encourage you to wait. So with multiple failed transfers, So I did kind of skip that part. Part of what we do when you first come in after your acupuncture and everything else is we go over your medication list. We make sure that, you're taking everything that's on our list. If you're not and something changed and it just didn't get updated, we always make sure that we update that for you. Dr. Kiltz has given us specific instructions as to like what protocols are what, and if people have had failed transfers, what we need to do. And then we make the changes that are necessary for to try to make it more successful. So hopefully that answers the question. But yeah, usually, and if there's ever a question, if you come in and for some reason it wasn't brought up, then just ask us. Just, let us know. Listen, this is my, third transfer. And we'll definitely make sure that we make some changes. And if we don't know the answers, we have many doctors and providers that we can find out from. Okay. Let's see. Holly, hopefully that answered that question with the medicine changes and frozen transfers and fresh transfers. Megan, it's kind of what you want to do. I mean, let me see. You're not going to change anything. Like as far as like protocols and stuff like that, you'll follow, your medication list. There's nothing different that you need to necessarily do for a frozen compared to a fresh. They'll give you your medication protocol. You just follow it. We do inner lipids here at our Syracuse office. I think all the locations have the lipids. And yeah, Elizabeth, the triggers, boosters, testing at home, like the triggers and the boosters will make positive pregnancy tests. So there's no reason to really waste your money on all that. Plus, you don't want that extra stress. Yes, Tammy, if try to aim to be here, but things happen. People get flat tires. You hit construction, which is huge in New York State. Lucky us. We will work it out. Just give us a call, let us know, and we always will try to make whatever we can easier for you. But yeah, especially if you have a noon transfer, we're not going anywhere for hours. Don't worry, we'll be here. 3. Sorry guys, just trying to read them before they disappear. Yeah, staying the night before is also very, it can help you relax. You don't have to stress as much about being on time. There's shuttles that'll bring you here if you didn't drive in. That's pretty typical that people bring either Uber or Lyft, or they just take the hotel shuttles. Let's see. Amber, there's never too many questions. Don't worry. It moved again. Sorry, guys. Okay. So your first lipid treatment really is up to you. Some people come in, when they first start their cycles. Some people wait until after their retrieval. They'll come in like a week or two before the, like if they're doing a frozen, they might come in a week or two before transfer. Some people just started at retrieval and then continue for a few weeks. Some people do it their whole pregnancy. It just depends. Some people do it one time and then that's it because they can't find somewhere to give them the infusion. So, it kind of depends on the situation, but one time is better than no times. So it's really, really a preference. And the lipids, Mallory, they help your body it helps the embryo if like you have the killer cells in your body so that it doesn't reject the embryo. Kind of helps it to stay put. Elizabeth, I don't know about the cost of things or how they do that, for if a fresh is canceled. It's not really my area. But usually if the fresh gets canceled, we sometimes we know before day 3, sometimes, you know, if you're growing out to day 5, we don't know until then. But it'll be something you'd have to ask, like billing or financial. You don't necessarily have to purchase the lipids ahead of time, Beth. You can get a script for it and we can send it. Sometimes it gets shipped here and then we use whatever we have on hand for you, and then yours would just replace what was used. So, you know, if you show up the day of transfer, you never asked for lipids before and you want to have them, then, you know, we're going to give them to you. You're just going to, you know, get your script or whatever, either bring it in to replace it or just have the pharmacy mail it right to us. And usually the nurses will take care of it for you. Elizabeth, if you were told yes, then I would assume that's the answer, but I don't know. I'm sorry. Massages could be done anytime. Some people have pre-massage and post-acupuncture. Some people have pre-massage and acupuncture and then post-acupuncture. Sometimes people have post-massage. It just kind of depends. You can do it pretty much whenever you'd like. Liz, if you want to start your lipids now, you can. Like I said, it really depends on the person and what you want to do. Please sick after having a retrieval. Some people, you know, don't feel very good, Katie, after their retrievals. Just have to. Sorry, I'm trying to still read it and talk, which isn't working out for me. Okay. Well, that's good that they both resulted in 2 separate pregnancies, Katie. That's awesome. I know, like, sometimes, like I was saying, the retrievals, some people do get sicker than others. You know, it just depends on the medications and how your body wants to handle those and process them. The HCG boosters, that'd be a script you could just send through your patient portal to ask for. Usually, a lot of people that have the boosters, they did a HCG wash ahead of time and they use half the medicine then. And since it's already mixed, you bring it home or back to your hotel, you put it in the fridge. And we'll give you instructions. It's 25 units in your lower belly. It's an injection every day, and it puts the hormone in your body, the pregnancy hormone. So your pregnancy test would be positive if you were to pee on a stick. So we don't suggest that. So you don't really necessarily have to buy them. It'll be a prescription. So if your insurance covers it, perfect. If not, then you know the pharmacy can tell you how much that would be. But just ask for it through your portal and they can get that for you. And we'll see you tomorrow, Crystal, it looks like. Just going right back to see where else. Yeah, Elizabeth, I would send a message to financial and ask them. I'm sure they'll have an answer for you. And if not, we can find out when you're here. Asks embryo prep before transfer. The embryo prep, I mean, obviously if it's frozen, you know, they're going to be thawing the embryos. They use the embryo glue in the assisted hatching unless somebody specifies that they don't want that. And then we also go over, you know, your grading and, you know, what you have for embryos if it's a fresh. Most people tend to know the grading of the frozen embryos, but if they don't, we can easily look that up and give that information to you as well. You can do acupuncture anywhere, Megan, if just make sure that you let the person know that you are, doing fertility. That way, um, and yeah, it doesn't matter if you've never done it. You can still try it. It's not going to have any harmful effect on you. Um, correct. Correct. So even if it's a couple days before transfer, that's fine. If you want and feel more comfortable, like we can always do your first one here while you're here for your transfer, because we specialize in fertility. So our acupuncturist can walk you through everything, talk to you more about it, um, and that way we know that you're nice and comfortable with it. Um, yes, Elizabeth, that's completely right. It does it puts the pregnancy hormone in your body, the HCG. So, it can help support the embryos. The embryo transfer process takes just a few, like 5 minutes maybe for the transfer part itself. We get your blood work. So, that's just a few minutes. We review all your medications. We make changes if that needs to be done. So, time kind of stands still around here. So, the transfer itself, it can take 15 minutes. It can take 2 hours. Generally not that long though. The process itself for the actual transfer is very, very quick. Um, Slow enough so that you can videotape everything, watch everything, you understand everything. The doctors are great about, explaining the process as we're going along. So it can take as long as you want or as quick as you want, really. Um, the ERA testing, there's different perspectives on that. I'm really not the one qualified to answer that. You can reach out to embryology or one of the providers through your portal, or just the nurses through your portal, and they'll talk to one of the providers, and they can kind of guide you, Anna. Oh. So our mock cycle, Elizabeth, is it's not really a mock cycle. We haven't like a catheter. It's like the introducing catheter that we place, and then embryology brings in the inner catheter, which we insert into the catheter that's already in you. So that's kind of like the mock um, process. So it's not like two different procedures or anything like that. Robin, yes. Yes, Robin, just reach out to the nurses when you start your next cycle, and then they kind of will guide you with the process and scheduling and all that kind of stuff. That's great, Katie. After the baselines, it kind of depends on when the transfer would be, like on your numbers and stuff. So I don't have an exact answer for you for that. The HCG wash is beneficial, and it doesn't take long. We do it right here in the office. We like to do it the day before, or even a couple days before, but not really the day of the transfer. The Pregnal can be the HCG wash. Medication, also the boosters. So yeah, don't use it unless somebody tells you to. But you can reach out if you haven't, like if your transfer is coming up, you can bring it with you if you don't have a wash scheduled, or you can reach out to the nurses and see about scheduling a wash, and we can go over all that stuff with you. Elizabeth, yeah, there's a couple different types of medications that are the same for the HCG stuff. There's a couple different names for it. I can honestly say, Christina, I don't know what a DE is. or I'm just blanking. If you want to tell me what it is, might be able to answer it. And Katie, no, actually, sometimes we recommend having DNCs or laparoscopies, things like that. If you have had some failed transfers and there's something more going on. So it's not going to screw anything up for you to have a transfer next year. Perhaps you should be great. And they'll tell you if there's any issues, but you should be fine. The ERA is really a preference, Heather, on, if you want to do that. I said a little while ago, there's a lot of different opinions on it and everything else. I'm not really qualified to say that. Lipids, definitely, that's a good thing to do. It would help. Definitely wouldn't hurt anything. Let's see. Acupuncture is done on the first day, or done on the day of transfer. A lot of people do it, probably like at least 90% of them. They have pre and post. So they'll do their acupuncture and then they'll have their transfer, and then they'll go back for another round of acupuncture. The process isn't painful. Most people feel nothing. Sometimes you'll have a little bit of a cramp. Kind of depends. Usually the most people that have the cramp, they might have had like a C-section previously, so there's a little bit of a scar there. But usually, Megan's correct. It basically is like a pap smear. Most people do perfectly fine. It's easy, not really a lot of pain involved. Just the uncomfortableness of like a pap smear. The PRP wash, they draw your blood, and then they spin it down, and they use the good stuff from that to do the wash. I think I missed something for Christine. Oh, donor egg. Never mind, I get it now. Really, there's no difference in protocol for yourself for a donor egg. Like you're still going to do the same medications and everything that whichever provider you're working with tells you to take. It's going to be the same as, it might be a little bit different, but it's still your body that the embryo is going into. So you're still going to have, the same medications and stuff that you're going to take. So there's not a whole lot of difference there. You would think I would have known that by just looking at DE, but nope, totally missed it. There's a lot of pros and cons that come in with transferring one or more embryos. There's always risk for twin pregnancies, whether they split or they both take. A lot of that has to do with age, quality of embryos, how many transfers you've had. Those are things that we would discuss when you're here for your transfer, or ahead of time. You can reach out through the portal or call, whatever is easier for you. Jay, natural cycles are kind of different for everybody. Some people are on a few medicines. Some people are just on a prenatal. I've seen a lot of different things. So it would kind of depend on what's going on. But the nurses or providers can go over it with you when they're setting up your cycles. We have a lot of success with day 3 frozens, the FETs, Sherry, yes. So the bird's eye view, you're going to come in, we're going to do your blood work and stuff. We'll go over your embryology information. We check your bladder, and then we'll do your transfer. We kind of walk you through everything. You'll do pre and post acupuncture if you choose to do so. It's pretty easy. Sorry guys, it's just skipping all over. Thank you guys. Have a good day too. It depends on the IVF from day one. You don't have to come from Florida and stay for the whole process. We have like global labs and testing that way, so they can do ultrasounds and labs and stuff like that where you live. Plus, we're opening the Florida office hopefully very soon in Sarasota, so that might be able to help you as well.
All right.
Let's see.
Okay.
There you go.
Amazing. Amazing.
Hopefully, I helped.
Yes, you did. Very much so.
All right.
Thank
Bye,
you, Lily.
everybody.
That was awesome. All right. Thank you. Thank you, Lily. That was awesome. Okay. Well, I'm sure she answered a ton of your questions, right? She answered a bunch of mine. That's for sure. I know a little bit more. I thought I knew it, but every day I learn a little bit more. Yes. You can get acupuncture on the day of transfer. I highly recommend it. Most people do, and we talked about why you would do that. And I've covered it in several videos before this. And I encourage everyone to go back. We had a massage therapist on, Kristen, not that long ago, and she talked all about what was going on with massage and embryo transfer. So you can look at that video too. It's in the library there. Acupuncture, you can get it anywhere. I strongly encourage everybody that wants to do acupuncture to do acupuncture on their day of transfer. But I also encourage you strongly to do acupuncture in your community. So find a local acupuncturist near you. And I really don't recommend traveling more than 30 minutes to go to your acupuncturist, unless you have other reasons to be in that area. If you can stack functions and do your acupuncture and do other errands, that's great. But, the idea with acupuncture is to be as calm and relaxed as possible. And if you're trying to fit it in and you're stressed about time and money, it's not worth it, right? A nap, meditation, yoga, that's all as beneficial as acupuncture. Let's see. I think was I missing an acupuncture question? I mean, you fielded a bunch.
I think there was just the like how soon or how.
Oh, I know.
Mhm.
What to do and what not to do.
Yes.
Be yourself. Be your normal self. Maybe slow your pace down a little bit on the day of your transfer. Try not to rush. I know, in moderation, time does stop here a little bit. It doesn't stop completely, but it does stop pretty much. So we're not going to rush you along. You're not going to miss appointments. You're not going to, get bumped. So slow down. Don't worry. We're going to see you when you get here. Sometimes we're busy, right? Just like everywhere, we're busy, and sometimes it takes us a little longer to get to you, but we always get to you. Quite quickly, I might add, too. I mean, these girls are really good. And so you don't have to do anything special. There's no do's and don'ts. Just come at your pace, drink a little extra water. We want you to have a full bladder. Thank you. And I hope you learn from these. And in the next week or so, we're going to have Eric Buxton on. He's going to talk to you about what he does in the andrology lab. And I'm really looking forward to that. And I know he is too. So thank you, everybody. And we will talk to you soon.